Now, what is a rest? Any component of a partial denture on a tooth surface that provides vertical support is called a rest. Okay, whatever which is there on the occlusal surface and provides vertical support is a rest. So anything which is on the occlusal surface is a rest. And the prepared surface of an abutment to receive the rest is called the rest seat. So when we are making a depression on the occlusal surface for the rest, that is the rest seat. And the metal component which goes and adheres to the rest seat is the rest. Clear? This is easy. Rest and rest seat. Now what are its functions? It maintains the components in their planned positions. Okay, because it is on the topmost surface, that is on the occlusal surface, it actually helps to keep all the components in place. That is, it helps in stabilization. It maintains established occlusal relationships and prevents settling of the denture, prevents impingement of the soft tissue. Because it is on the occlusal surface, it will actually prevent the denture from going down and impinging on the gingival tissue. It will stay up only. And it distributes occlusal loads to abutment teeth. Okay. So these are its functions. Okay. Now whenever we are making a rest, we need to follow certain rules. Now what are these rules? The topography of the tooth that existed before the rest seat was prepared should be maintained. Okay. Now if you people have this tooth, okay, and then you make a rest surface area like this. Your rest should exactly go and stimulate your topography. Okay? Clear? This is clear? Whatever depression you have made, your rest should go and exactly adhere and it should duplicate your topography of the tooth. The next is the outline form of an occlusal rest seat should be rounded, triangular in shape with the apex towards the center of the occlusal surface. I'll show you a photograph so it's clear. See, this is how your occlusal rest should be. It should be rounded, triangular with the apex towards the occlusal surface of the tooth. Okay? Next, it should be as long as it is wide. Okay? Base should be at least 2.5 mm for both molars and premolars. So the base of your triangle, this base of the triangle should at least be 2.5 mm for your molars and premolars. So you understood, your apex should be rounded, triangular towards the occlusal surface and your base should be 2.5 mm wide and it should exactly simulate your normal tooth. Okay? What happens, Saurabh? The base should be 2.5 mm wide. The base of the triangle should be 2.5 mm wide. There are 3 points to be remembered. The triangle should have a rounded triangular apex. The base should be 2.5 mm wide and it should exactly help in transferring the same tooth surface. That is, the topography of the tooth should be maintained. Now got it? Okay. Now, there are still more points. The rest seat should allow slight movement of the rest to dissipate unwanted forces. Okay? It should allow for the slight movement of the rest. The floor of the occlusal rest seat should be apical to the marginal ridge and the occlusal surface and should be concave or spoon shaped. Now the floor of your rest seat should be concave or spoon shaped. Okay, it should not be box shaped like your cavity preparation. It should be concave or spoon shaped. The rest should be aligned to the crest of the ridge. Now what do they mean by this is, when there are teeth like this, okay, this is your ridge. So your rest should be in the line of your ridge only. Your rest should be always in the line of ridge as much as possible. See, you should not actually involve the marginal ridge. Yes, you have to put the mesial and the distal marginal ridges, you need to depress them a little. We'll come to that also. Obviously, you need to put a depression in the marginal ridge for your rest to attach. We'll come there. First, you pay attention to this. So, it should be aligned into the crest of the edentulous ridge. Okay, this should be concave or spoon shape, and it should allow a little more of, it should allow movement. See, a reduction of a marginal ridge of approximately 1.5 mm is usually necessary to permit a sufficient bulk of metal. So, you need to reduce the marginal ridge by about 1.5 mm. Okay, now you got it, Saurabh? So, the dimensions are, it should be rounded triangular in shape apex, 1.5 mm wide, 2.5 mm wide, and marginal ridge should be reduced, length should be 1.5 mm, marginal ridge should be reduced for marginal ridge should be reduced to 1.5 mm, it should be concave spoon shaped, it should be aligned to the crest of the ridge, and it should allow slight movement of the rest. Okay, so you understood the rules for making a rest. It's made on the occlusal surface, proximo-occlusal surface. We'll come to that when we classify rests. Okay, where these rests can actually sit, on all what surfaces they can sit. We will come to that. Right now, just pay attention to the basic rules of the rests. Okay? Okay. So all of you understood the rules of the rest. Okay, there is one more. The angle formed by the occlusal rest and the vertical minor connector from which it originates should be less than 90 degree. Okay. Now what they say is, if this is your rest and this is your minor connector, it should be less than 90 degree. Why? Because your rest cannot lie like this, okay, with the minor connector. It cannot be 90 degree or more than that. It will displace because it has to go along with the tooth. So it should be less than 90 degree. Okay, it should be less than 90 degree to the minor connector. So these are the basic rules. So remember the values: 1.5 mm wide, 2.5 mm wide, 1.5 mm reduction of the marginal ridge, rounded triangular apex, concave or spoon shaped floor along with the crest of the ridge, and the angle with the minor connector should be less than 90 degree. Clear with the rules? Okay, all of you. Now the classification of rests. Now what are the different types of rests? There are many types of rests. Now on the relation to the relation of the rest to the direct retainer, we have a primary rest and we have a secondary rest. Yeah, this may not be in notes. Just make a, because in the notes you have all the rests. This classification may not be there, but you have all the rests. Don't worry about that. Okay, so there is a primary rest and a secondary rest. Now what are these? We'll come to that later. Based on the location, if it's on the occlusal surface, it's an occlusal rest. Incisal surface, incisal rest. Interproximal rest. Based on the shape, V shape, semilunar shape, triangular shape, and there are other modification also of rests. Okay, so we come to primary rest. Now what is primary rest is, okay, this is your primary rest. Whatever is there in the fulcrum line is your primary rest. Okay, but to prevent your rotation of the denture in the fulcrum line, we need to give an additional rest. Okay, primary rest is something which is given on your posterior most tooth, primarily along with the, they go along with the clasp assembly. This is your fulcrum line. All of you know what a fulcrum line is? Okay. So, when your rest is along with your clasp, which is along with your clasp assembly at the posterior most tooth are your primary rests. They primarily provide whatever is the purpose of the rest. But this will cause rotation of the denture. So you need an extra rest. So the extra rest which is not in the fulcrum line, okay, it is away from the fulcrum line, is your secondary rest or auxiliary rest. And this auxiliary rest was connected by the minor connector to that major connector when we did classification of minor connectors. Now can you, it's an indirect retainer. Don't talk about that because you'll get more confused. When we talk about indirect retention, we'll talk about this principle. Now just pay attention to the fact that what is a primary rest and auxiliary rest. Okay, and just when we are talking about that, I'll just like to tell you that the auxiliary rest was connected by a minor connector to the major connector. Remember when we classified minor connectors? Yeah, so this is that auxiliary rest. So now you got it. Now you can put it together. You can put it is at 90 degrees to the fulcrum line, no? Primary is along with the retentive clasps. See, when we are talking about the clasp, there is a rest, there is a body, there is a shoulder, there is a retentive. We'll come to that later. Okay, so rest which is along the fulcrum line or along the clasp assembly is the primary rest. And auxiliary rest is something which is not in the fulcrum line, which is away, which is an additional rest, just to help in stabilization and prevent the rotation of denture along the axis of rotation of the fulcrum line. Getting me? All of you? Okay. Now, this is what Nallaswamy says about primary and secondary rest. No, Saurabh, not only in distal extension. In any case, even if your last tooth is here, this is your fulcrum line, you can put an auxiliary rest over here. Auxiliary rest is a rest which is not in the fulcrum line, which is an additional rest other than your clasp assembly. Okay. Now according to McCracken, he says when an existing occlusal rest preparation is inclined apically towards the reduced marginal ridge and cannot be modified or deepened because of fear or perforation of the enamel or restoration, then a secondary occlusal rest is employed. What he says is, now if you have a tooth which has a reduced marginal ridge, okay, you have a tooth like this, your abutment tooth has a reduced marginal ridge. So if you try to make a rest seat, a deep rest seat, what will happen? Already your marginal ridge is reduced. You are reducing more it is attrided. It is a tooth which is attrided. Okay, or is restored with something. And the marginal ridge is not up to the entire mark. It is not proper. It is reduced. So now if you try to make a rest seat area in this place, what will happen? When already your occlusal surface is, yes, it will lead to a perforation of the enamel of the pulp or of the restoration. So what do you do in such cases? When you have a tooth which is like this, you give a small rest over here and you give an additional rest on the other side, okay, to prevent because this rest will not serve the entire purpose because it is not up to that mark. It is a very minimal shallow area created. So we will create an external part on the other side also. We will create a rest on the other side of the tooth also. It is just like we are not able to support the tooth with one finger, so we are applying pressure with the other finger also on the other side. Okay. So this is your secondary occlusal rest which will actually help in providing you which will help in doing the rest job. Getting me? So according to Nallaswamy, he says primary rest is along with the clasp assembly and auxiliary rest is something which is not in the fulcrum line. But yeah, on the same tooth, Radhika. But McCracken says secondary occlusal rest is something like this. When there is a reduced marginal ridge, instead of having one rest area, we give an additional rest area on the opposite side which serves the purpose. So that we have proper retention, or you can say proper stability or support. Okay, that is a secondary occlusal rest, an extra occlusal rest. Secondary occlusal rest is an auxiliary rest. Yeah, Nallaswamy should have followed McCracken, but he didn't. So there are a lot of confusions, but always go with the McCracken book. McCracken says secondary occlusal rest is given in such conditions, and secondary occlusal rests are auxiliary rests. Auxiliary is an addition, okay, addition to the primary rest. No, only one is secondary. The one we are giving on the opposite side is secondary. Okay. Now clear with secondary occlusal rest and primary occlusal rest? Okay. Now we come to the place where it is. According, see, I told you, it is classified according to this based on the relation to the direct retainer, that is primary and secondary. Now based on the location. So wherever it is placed, it is named after that. If it's on the occlusal surface, it's occlusal. If it's on the incisal, it's incisal. Now we'll talk about the occlusal rest, okay. Now occlusal rest, we have already talked a lot about that. That it should be spoon shaped and all that. It should be 1.5 mm wide and all. There are certain other considerations you need to know. Okay, it should have a width which it should measure half the width of the tooth buccolingually and 1/3 of the tooth mesiodistally. Okay, these are the widths of. Now they have given you basic rules earlier. Now they are giving you specific rules according to each rest. Occlusal rest, incisal rest, cingulum rest and all that. Okay, so when we are talking about occlusal rest, the width should be half of the entire width buccolingually, and mesiodistally it should be 1/3 of the entire mesiodistal width. Okay. Next, the floor of the rest seat should be less than, this we have already learned, it should be less than 90 degree. The rest to the minor connector should be less than 90 degree and it should not be more than 90 degree to prevent displacement. Okay, that is the same rule for. Now we have the same rules coming in every rest, but I'll just tell you for each there may be a difference. I'm telling you that. So in occlusal rest you need to know these dimensions. Okay, buccolingually half of the width and mesiodistally 1/3 of the width, and it should be less than 90 degree. Okay, clear? Next is the, okay, this is an extended occlusal rest. Okay, it is on the occlusal surface, but it is extended. Now, see, this is a case whenever there is a mesially tipped molar, an extended occlusal, this is also something like an auxiliary rest. We are giving additional support. So what we do, the rest should extend more than 1/2 of the mesiodistal width of the tooth. Okay, here what we are doing, the occlusal rest normally should be till here. Okay, it should only be till here. But here we are extending it like a class 2 occlusal proximal preparation. We are extending it, okay. Normally it should only be till here. But we are extending it in tilted cases where we need extra support. So that is an extended occlusal rest. That's it. Okay. Next is incisal or cingulum rests. These are also known as anterior rests. Okay. Anterior rests are nothing but the rests which are on the anterior tooth. Now they can be either on the incisal surface or they can be on the lingual surface. Okay. Now there are two things you need to know here is, now which are the anterior teeth which can be used for such rests? The incisors and the canines. And which are the two surfaces? The incisal and the lingual. Okay, so there are two types of teeth and there are two types of surfaces. Now what they say is, in teeth, a canine is much more preferred over an incisor When a canine is not present, multiple rests that are spread over several incisor teeth are preferable. Now what they are saying? They are saying that a canine is more preferred over an incisor because it has more strength. Okay, and also for aesthetic purposes. And they are saying a lingual rest is preferable to an incisal rest. That is, a cingulum area rest is preferred to an incisal rest because it is placed near the horizontal axis of rotation. Okay. Now what they are trying to say is, see this diagram. You people can see this slide? Okay. So they are saying that a cingulum rest is better than an incisal rest because the distance between the cingulum and the axis of rotation is less. See, this distance is less as compared to this distance. So they say when the rests are closer to the axis of rotation, it will be more stable. Okay, so you want a rest which is closer to the axis of rotation. So lingual rest is closer or an incisal rest is closer. Which one is closer? Yes. So what they are saying here is a canine is preferred over an incisor and a lingual area is preferred over a incisal area. These are the two things they are saying. Got it? Now we'll talk about individually. Now incisal rest, they say the incisal rest should be 1.5 mm away from this angle, proximo-incisal angle. It should not be, if you have to place a rest on the incisor, there is no alternative. The rest area should be 1.5 mm away from the proximo-incisal angle. You should not fracture the proximal incisal angle. Secondly, the dimensions. It should be 2.5 mm wide. Okay, this should be 1.5 mm in length. That are the dimensions to be learned. It should be 1.5 mm away from your proximal incisal angle. It should be 2.5 mm wide mesiodistally and 1.5 mm wide occlusogingivally. Depth is separate, Saurabh. Depth we have already talked that it should be spoon shaped or carve shaped. Okay. Here they have not talked about the depth. Here they have just talked about the dimensions. Depth also should be taken care. It should not be very deep. It should be spoon shaped. It should not be it should not be box shaped. Okay. So these are dimensions of incisal rest. Cingulum rest is, it should be 2 mm wide labiolingually and it should be 1.5 mm deep when measured incisogingivally. Okay. Here they are giving you the depth. So these are the dimensions you need to learn. Just see if they are there in the notes. If they are not there, just make a note of it. This is a cingulum rest. It is better than the incisal rest because it is near the axis of rotation. It should be 2.2 mm wide labiolingually and depth should be 1.5 mm deep. Okay? Clear? Understood the occlusal rest, the extended occlusal rest, the incisal rest and the cingulum rest. Okay. Now the interproximal occlusal rest. What is this? This is something where we put the two rests over here in the interproximal area. Okay. These are the interproximal rests which are together. Okay. Now, what will you, okay, we'll come to the modification later before you get confused. These are interproximal rests, interproximal occlusal rests which rest on the occlusal and the proximal surfaces of two teeth. So they are interproximal between two occlusal surfaces of the teeth. Okay? Okay. Now that was based on the location. Now based on the shape, that is easy. When it is triangular, it is known as a triangular rest. It's V-shaped and this is semilunar. This is clear according to the shape? Okay. Okay, now we'll come to the modifications of the rests. Now, what are the modifications is a partial denture that is totally tooth supported by means of cast retainers on all abutment teeth. We use intracoronal rests for both. Now, what is intracoronal rest is something which is inside the coronal surface of your tooth. It does not lie outside. It is like It is like creating this box-shaped structure on your proximal surface. Okay. This is a structure on your proximal surface where your rest goes and gets engaged. So it is more aesthetic because your occlusal surface will actually not show you the rest. Okay. But this can only be used when it's totally tooth supported by means of cast retainers. Yeah, they were all extracoronal, but don't divide it according to that because there are retainers classified as those things. Here you keep them as intracoronal. Others were all outside. They were on the lingual surface, on the incisal surface, on the occlusal surface, interproximal surface. You could see all those. These rests are actually inside the part of the tooth. Okay, they are actually embedded inside the tooth. That is why they are intracoronal. Okay, the rest goes and gets added there. Now, one thing is aesthetically it is good. Secondly, it gives occlusal support and horizontal stabilization. Okay, because it is covered from all sides. It helps in horizontal, providing horizontal stabilization also and occlusal support also. Other rests provide only occlusal support. This provides both. This is one MCQ asked. This is an extra advantage of intracoronal rests. See Saurabh, it is something like a box-shaped proximal preparation where you do not prepare the occlusal surface. You only prepare the proximal surface. You remember box slot preparations and class 2 preparations? It is something like that. Yeah, so whenever you prepare a box in your proximal surface, your rest goes and gets seated. Intracoronal, inside the crown. So it is more aesthetic and it also helps in providing horizontal stabilization because it is covered from all sides. The rest will not get displaced. The marginal ridge is intact. Okay? Now understood? That's a modification. See, there are again disadvantages of it. There may be, you may perforate the pulp. Okay? Yeah, there are disadvantages, but it's just a modification. Next modification is when there is a space between two teeth. No, why marginal ridge cannot be intact? That was the general rules, Dhara. That was for all the normal rests. These are modifications. Okay, now we'll come to the modifications of the rests. Now, what are the modifications is a partial denture that is totally tooth supported by means of cast retainers on all abutment teeth may use intracoronal rests for both. Now, what is intracoronal rest is something which is inside the coronal surface of your tooth. It does not lie outside. It is like creating this box-shaped structure on your proximal surface. Okay. This is a structure on your proximal surface where your rest goes and gets engaged. So it is more aesthetic because your occlusal surface will actually not show you the rest. Okay. But this can only be used when it's totally tooth supported by means of cast retainers. Yeah, they were all extracoronal, but don't divide it according to that because there are retainers classified as those things. Here you keep them as intracoronal. Others were all outside. They were on the lingual surface, on the incisal surface, on the occlusal surface, interproximal surface. You could see all those. These rests are actually inside the part of the tooth. Okay, they are actually embedded inside the tooth. That is why they are intracoronal. Okay, the rest goes and gets added there. Now, one thing is aesthetically it is good. Secondly, it gives occlusal support and horizontal stabilization. Okay, because it is covered from all sides. It helps in horizontal, providing horizontal stabilization also and occlusal support also. Other rests provide only occlusal support. This provides both. This is one MCQ asked. This is an extra advantage of intracoronal rests. See Saurabh, it is something like a box-shaped proximal preparation where you do not prepare the occlusal surface. You only prepare the proximal surface. You remember box slot preparations in class 2 preparations? It is something like that. Yeah, so whenever you prepare a box in your proximal surface, your rest goes and gets seated. Intracoronal, inside the crown. So it is more aesthetic and it also helps in providing horizontal stabilization because it is covered from all sides. The rest will not get displaced. The marginal ridge is intact. Okay? Now understood? That's a modification. See, there are again disadvantages of it. There may be, you may perforate the pulp. Okay? Yeah, there are disadvantages, but it's just a modification. Next modification is when there is a space between two teeth. No, why marginal ridge cannot be intact? That was the general rules, Dhara. That was for all the normal rests. These are modifications. Modifications do not generally go with the general rules. They are modified due to some reasons. To provide extra support, to provide extra aesthetics. Okay. Yeah, so slot will go in the proximal area only. The occlusal surface, you people have learned slot preparation in class 2, remember? Whenever there is an edentulous space and there is proximal caries, you just prepare the proximal area. You don't go occlusally. You just prepare the proximal area. So this is something similar. Okay, getting me? So intracoronal provides extra aesthetics and horizontal stabilization. That is the MCQ asked. Okay, now the next modification is if there is a space between two areas, what you can do is it is filled, there is a modified rest and this is a pontic the rest is attached to the pontic. Okay, so this is a modified rest which helps to, this is an interproximal rest. That is what I was trying to tell you in interproximal rest, that if there is space between the two, we can place a pontic along with the rest. Okay, that is a modification. Next is, I told you, a canine is always better than an incisor. Remember? But if there is no canine, which is not aesthetic, this pontic class, no, pontic of normal tooth. This is white tooth. Only the rests are made up of metal. Okay, the tooth is not metal. The tooth is normal. Okay, next is I told, got it? Who had a doubt? Radhika, okay. Now, I told you a canine is always better than an incisor. But in cases where you cannot have, I actually don't know how to connect it. There must be the similar way of casting and all and then making your acrylic teeth. First casting will be done with the entire prosthesis and then your RPD will be placed. I actually don't know how it is done. I'll get back to you on this tomorrow, okay, when we have the next class. Okay. Now I was telling you that a canine is always better than an incisor. But in cases where you cannot take the support of the canine, what do? Multiple incisal rests are connected lingually by a plate of metal. Okay. All multiple lingual rests are connected with a metal plate so that you get additional support. Okay, so these are the three modifications. Intracoronal rests, pontic clasp rests, and multiple incisal rests. Okay? Okay. Okay. So the floor of the rest seat should be at what angle? Or the rest seat should be at what angle to the minor connector? Yes, less than 90 degrees. Good. Multiple incisal rests provide three. Good. Cingulum rest is preferred over incisal rest. Why? Good. Extended occlusal rest is used in which case? 2. Good. Marginal ridge should be reduced by 4. Rest seat is what? Rest area, sorry. Or the rest seat. 1. Yes. Intracoronal retainer provides what? Yes. It provides horizontal support and occlusal stabilization. Okay. Okay. So, what you people are not clear is about the Pontic class. How it is adhered to that. Other than that, you people have any other doubts? Okay. So you people are clear with the 4 types of minor connectors? You people are clear with the, maybe it may be a metal Pontic, Radhika. I am not sure about it. Because if it is in the posterior, a metal Pontic will do. But I'll just get back to you if it is in the incisal area or in the anterior portion, how do we take care of that? Okay? Okay, you people are clear with the 6 maxillary major connectors, with the 4 types of minor connectors, and with these rests. No problem, external finish line, internal. Okay, somebody had a problem in external and internal finish line, right? Okay. So, Saurabh, you told me that auxiliary rest you were not clear. Now you are clear how the minor connector connects the auxiliary rest to the major connector? Okay. And somebody else had a problem with external and internal finish line. Okay, before you people start going, let me tell you, there is a lecture tomorrow at 6:30. Okay, where we'll be continuing with the direct retainers and the indirect retainers. Preferably, I'll finish it in an hour. Okay, and on Saturday at 7 o'clock, there is another, whatever was there tomorrow, the pre-test on your CD and FPD. That is postponed to Saturday 7 p.m. Okay? Tomorrow 6:30 we'll have a continuation of RPD. Saturday 7 p.m. Dr. Bhavna will take the class. Okay? Okay, so yeah, Saurabh, I answered it on Facebook only. And you had also asked about beading. I told you we'll talk about it in lecture today. You did not? Okay. So see, what I got to know from the articles was, they said that a face bow has parts. That is a ear bow, a nasal orbital marker, and your bite fork. Okay. So there they say, when you are taking the axis orbital plane, okay, there you just need to have this part, your ear bow, for your orbital reference point and your ear points. This will help you in marking your axis orbital plane. When you need to orient your mandible to this axis plane, that is terminal hinge axis, that time you put your bite fork. So when you are not putting, there what they are asking you, there they are asking you how to measure the axis orbital plane. So axis orbital plane, you do not need the entire face bow. Only the ear bow is enough. So the link I have put there in Facebook, if you click that link, they have shown you step-by-step procedure, and there they have mentioned tighten the ear bow. Axis orbital plane is this plane. It is your orientation axis. Okay, it is a reference plane with which you can put your mandible into. It is a reference plane. So that is the first thing you obtain. Next you put your bite fork, and then you ask the patient to bite where you measure your terminal hinge axis. So there are 2 planes. The axis is orbital plane and then your terminal hinge axis. I have explained it in Facebook. What are the 2 planes? Yeah, it corresponds to the ala tragus line only, I suppose. Because it takes the nasal points and it takes your ear points. So I suppose it's the ala tragus line only. But ala tragus line is a line. We are talking about the entire plane. Okay? The plane which actually, the orientation of the maxilla to the cranial base. For that you need only the ear bone. When you want to put your mandible in orientation to the maxilla, you put the bite fork. That is a, but there are articles which say ear bone and face bone to be same things. Okay, but most of the articles say ear bone is a part of the face bone. So I guess we will go along with that because that question is very tricky. Because ear bone is also there, kinematic face bone is also there, arbitrary face bone is also there. So I guess you should go with the fourth option. When they tell you about the terminal hinge axis, how would you measure the terminal hinge axis? 2006. Okay. When you measure the terminal hinge axis, that time you can talk about the kinematic and arbitrary face bone because you need the entire face bone. You need your ear marks also and you need your bite fork also. Okay. I'll still do a reading on that. And if there is something contradictory to this, I'll put up. Otherwise, you people can go with the option D. Okay. And beading, you people. Answer given both. Both means C and D both. C and D both. All the three bows. You cannot write. Okay, it says option C, arbitrary or kinematic face bone. Okay, I'll get back to you on this then again. C option. Okay, I'll get back to you on this again because that ear bow is something which is very contradicting. If there was something else other than ear bow, you could have gone with option C. But if they are specified ear bow, there must be a purpose. If I have that solved AIPG 2006 paper, I will just once check and let you know. Okay? Pardon, yeah, I guess I have Gauri Shankar solved papers. I don't know whether I have 2006 because I myself gave the exam in 2007. So I don't know in 2006 whether I had that paper or no. I'll just check. And I'll check the articles also. Okay. And beading, you asked a question of beading. Now, is that clear now? Yeah. And someone had a problem with internal and external finish lines. Okay, that is the only shunting in prostho. I don't know. It's in CD. Okay. So I'll talk about shunting also tomorrow if I get to. Okay. What is parallel to the alveolar ridge, Saurabh? Rim is parallel. Okay. The occlusal rim is parallel to the alveolar ridge. Okay. I will just see that whether a term like shunting is given somewhere. If not, then shunting. Okay. But we'll still get back to it tomorrow. Okay. In this part today, does anybody have problems? Kamal had a problem in finish lines, right? Do you want me to explain or you're clear with it now? Finish lines. Okay. Lohita had a problem. I'm sorry. Okay. Yeah. Sunday. I don't know about it. Sunday there is a test. Okay, I'll tell you about that also tomorrow. Saturday there is a class at 7 by Dr. Bhavna. That is what I know now. On Sunday about the test, I think it's on CD and FPD only. Okay. Okay, so we'll go back to finish lines and finish it fast. Others are all clear with all the types of minor connectors? Okay. Now, finish lines is something which is given in lattice. Lohita, you were there at lattice and meshwork at least, the two subdivisions of the minor connector connecting the denture base to the major connector. Okay. Now what is that? It's a minor connector which connects the denture base to the major connector. So it is No, denture base is the acrylic denture base. Okay, major connector is the metal part and denture base is the acrylic denture base. Okay, so it connects those two things by a minor connector which is in the form of external or internal finish lines. Okay, it is something like this. Okay, this is the framework of your minor connector. Okay, this is your major connector over here. Okay, and your denture base will come over here, over this framework. So this will actually help in connecting your major connector to your denture base. Now clear? So this framework can be either longitudinal, that is lattice work, or it can be crisscross, that is mesh work. Okay. Now what are finish lines? Finish lines are something which is okay. Finish lines is, there are two finish lines, external finish line and internal finish line. Okay. Now, okay, you can see this diagram, Shweta. This is the maxillary major, this is the minor connector, the metal part over here, and this is the major connector over here. Okay. And this pink color above and below it is the denture base. So the minor connector is actually connecting your denture base to the major connector. Now, the inside surface, okay, on the mucosa, the finish line is known as the internal finish line. And on the external surface, the finish line, that is the junction between your denture base and your major connector, is the external finish line. Okay, so these are the two finish lines. The external finish line is above and the internal finish line is below. Clear? Now what they say is this angle between the minor connector and the major connector should be less than 90 degrees or should be 90 degrees. Okay, it should not be more than that. Okay, I'll draw it here separately. This is your major connector coming from here and this is your minor connector over here. Okay, there is no acrylic denture base now. We are just talking about the metal parts. So the angle between your major and minor connector should be 90 degrees or less than 90 degrees. Okay. It should not be more, because what will happen when you have something which is more than 90 degrees, there will be more of acrylic. If this is more than 90 degrees, you will have a lot of acrylic over here. Okay. And we do not want a joint like this. We want a straight joint, a butt joint. Clear? Now when we pour acrylic, first we get the joint angle between the major and the minor connector. Then when we are pouring acrylic, okay, acrylic base over here and acrylic base over here, there should be a butt joint between two, the metal and the acrylic. Okay, this is the butt joint. That is, the joint should be proper. It should be not angulated. It should be in a proper manner. Okay, because of this angulation over here between the major and the minor connectors, we will be able to establish a proper butt joint between the denture base and the major connector. Now clear? The angulations are inside and the butt joints are outside. Now clear between the external finish line, internal finish line and the butt joints? Okay. All of you? Okay. Any other doubt? Tomorrow we'll be talking about the direct retainers and the indirect retainers and whatever doubts we had today about the pontic clasp. Okay? So I'll see you tomorrow then at 6:30. Okay? Bye. Good night.